All right. Welcome to the 33rd Annual Conference of the Adoptive and Foster Family Coalition of New York. This is a workshop session, I believe it's 10B. Sweet Dreams After Scary Times, Addressing Sleep Problems Following Trauma. In this workshop, we're going to hear from Dr. Alicia Pointer, who is the chief of pediatrics at Cornerstone Family Healthcare. She's also the director of the STAR Foster Health Program, which provides medical care, mental health support, and healthcare coordination for all children in foster care in the care of Orange County. Dr. Pointer is also an advisory council member for the Adoptive and Foster Family Coalition of New York, the organization that's putting together this conference. So before we begin, I just want to introduce myself. I'm Pat O'Brien. I'm the executive director of the coalition, and I'll be your moderator for today's Zoom. And I want to remind anybody who might want training certificates, please have your full name out there, and I'm going to put the training certificate link at some point during the call. During the workshop. And if you have any questions, feel free to put them in the chat box, and we'll let Dr. Pointer know. And or else she might just say it's okay to get off mute and ask her a question. That'll be up to the presenter. And we also want to keep in mind that we have a book table, and we ask you to fill out the evaluation, and I'll put those links in throughout the workshop as well. But in the meantime, I'm going to turn it over to Dr. Alicia Pointer. And thank you so much for being with us this evening, Alicia.
Thank you, Pat. It's an honor. I was saying to Pat before we logged in, I said I should have just given you guys this hour and a half to take a nap, because that's probably the best way to help with your sleep. But instead, you guys are stuck here with me. So I'm going to share my screen, and Pat, I don't think I'm going to be able to see the chats once I do. So I might need your help with reading some of the chats to me once we get to that part.
Sounds good.
Okay. So as Pat mentioned, today I want to talk about sweet dreams after scary times. And specifically, I want to talk about how to help kids get a better sleep after experiencing trauma. So we're going to cover lots of parts of sleep and different causes of sleep issues. But like I said, the focus is going to be on kids who've experienced trauma. So there may be some things that we don't cover today, things like, cry it out or putting a gate by the bedroom door. And it's not necessarily because I don't believe in those things, but because some of those things can be harmful more than helpful in the setting of trauma specifically. And I really do want this to be interactive as much as possible. There are a couple times when I'll specifically be asking you guys questions, and I would love to hear some of your responses. But certainly if anyone has questions in the meantime, feel free to just jump in and ask. Most of my best ideas come from other families telling me what worked for them. So if you're afraid that I'm going to steal your ideas and give them to other people, you're probably right. But I think that it really does help some of the other families that I work with. So I would love to hear some of your input as we go. I want us to start off by thinking about trauma or thinking about scary events as this tiger that's outside of your home. And I'm sure you guys have thought about this before or heard about this analogy before. So if there's a kid and they have this tiger that's always there, or maybe just comes a couple times, but is very scary to them, they're going to react in certain ways. So their eating, their bowel and bladder habits might change because the focus is on avoiding this threat, dealing with this tiger. Their sleep is certainly going to change because you can't sleep soundly if something could attack you or scare you at any time. That's not safe for you. You need to be always alert. You need to be always vigilant. And that's a helpful response that your body has to this stress. Other things are going to change too. Your concentration, your focus, memory for other things are going to be decreased because all of your attention needs to go to this scary thing that can hurt you at any time. So sleep disruption in this case is really a normal and helpful response. It helps you to be ready for what can come, for what can hurt you. Unfortunately, our bodies don't do a very good job of differentiating between this acute stress, like a tiger, and chronic stress. And they also don't do a great job of shutting off that stress response once the scary event is past or once the scary thing is gone. So when we have a child who comes into the office and has a poor sleep after experiencing something very stressful, I don't think what's wrong with this child. I think they're doing exactly what they're supposed to do, except now it's not a normal or helpful response anymore. Now it's actually harming them, and we need to find a way to reverse or calm that stress response. Trauma affects our body in many different ways. And we're going to talk specifically about how trauma affects sleep. So we know that the brain, when exposed to trauma or exposed to chronic adverse experiences, produces these neurotransmitters, these chemicals that go to our adrenal glands, which sit right on top of our kidneys. And our adrenal glands produce a couple things. They produce norepinephrine, which we also know of as noradrenaline, and they produce cortisol. And cortisol is what we really think of as the stress hormone in our body. It does a lot of things in our body. So from kind of right to left on this chart, it affects children's growth and development. It affects their immune system, certainly affects their GI tract, can affect their blood pressure and their heart rate. And what we're going to really focus on is how it affects their brain. So cortisol and norepinephrine go back to the brain and affect several areas of the brain. A couple of these directly affect sleep. So one part of the brain they affect is the amygdala. This really affects our arousal, that like hypervigilance that I talked about, kind of always being on alert. Also affects our sleep regulation. It affects our emotional regulation when we're awake, our fear response, even our decision-making capabilities. So that's one way it affects sleep. These same chemicals also go to our prefrontal cortex, which is our executive function, kind of our like risk reward, more of that decision-making. It also helps us to know whether something that we're afraid of is kind of real or not real. So those real versus perceived fears. And it really helps with this deeper sleep and sleep physiology. So we know that these chemicals, like I said, are doing what they're supposed to do. They're feeding back into our brain and affecting our sleep. So these sleep disruptions aren't a conscious process, but more of a neurochemical process that's going on in our bodies. Sometimes I have a family who brings a kid into the office. They say the kid is having a lot of sleep troubles, but this is what the child looks like when they see me. They're happy, they're engaging, they're interactive, they're doing great. And the family says, I'm not sure that this is trauma because during the day, they seem fine. Now, I will admit there are many sleep issues that are not related to trauma, and we'll talk about that a little bit later. But just because a child seems fine during the day doesn't mean their sleep issue isn't trauma. And there are a few reasons that kids can have these issues at nighttime that they don't have during the day. So one is this hypervigilance that I talked about. During the day, you're awake, you're alert, you're ready for that tiger, that danger. But at nighttime, you still want to be alert and active, and that prevents you from going to sleep. Some things are much more simple. So maybe kids are feeling really alone, and being around people is what gives them that security, and they're not able to have that at nighttime. So that makes them feel insecure, makes them feel more worried, revs up that fear response even more. Sometimes kids are triggered because their trauma happened at nighttime. Lots of family removals happen at night. If kids are exposed to alcoholism or sexual abuse, a lot of times those happen at nighttime. So it's possible that something scary happened to them at night. And so as soon as it gets dark and they're in bed, that gets kind of reminded in their mind, and they start to feel scared again. They start to feel nervous again. That's what post-traumatic stress disorder is. And then it could also just be that at nighttime, a lot of kids are with their own thoughts. During the day, caregivers do a great job keeping kids active, keeping kids busy, keeping them distracted. But we all know at nighttime is when you're laying there, you're alone, you have nothing else to do, and you can think about those fears and worries that you have during the day. So even if, the kids are used to sleeping at your house and now all of a sudden they have sleep issues after this trauma, or a lot of families will say, I don't think this is trauma because this is a much calmer environment than where they were before. The trauma's gone. And as we know, that trauma response doesn't go away. We talked a little bit about how trauma affects sleep. I also want to touch on how sleep affects trauma. So when children and adults, this isn't just people who've been exposed to trauma, this is children, adolescents, and adults. This has been studied over and over again. When they're exposed to sleep deprivation, they tend to have a stronger negative reaction to things that are stressful and a decreased reaction to things that are positive. So things that are troubling seem bigger, things that are happy seem smaller. We all know that we have less emotional regulation when we don't get enough sleep. I think we've all been in that position at some point. We're more likely to use punishment, have more hostility. It's harder to tell the difference between something that's threatening or scary and something that's not. So if you're not sleeping because you're scared, then not sleeping actually makes you more scared, which makes it harder for you to sleep. And it's this really challenging cycle to get out of. Likewise, kids and adults who aren't sleeping have more anxiety, depression, paranoia, even aches and pains, all of these things that can also keep you awake. And I think we need to remember that if we have a child that's not sleeping, that child doesn't exist alone, right? It's also us who's not sleeping. So we have all of those responses that we talked about in the last slide, all of that kind of increased hostility maybe and increased anxiety within ourselves, significant fatigue. I mean, caregivers who are dealing with a child who's not sleeping are exhausted themselves because they're not sleeping. Maybe feelings of isolation. If your usual support system is your stress relief, that support system probably isn't going to be there and available at 1 o'clock in the morning when you're dealing with a child who's not going to sleep. And then all of these other feelings that come from not being able to put your kid to bed, helplessness, frustration, expectations on yourself and from other people, maybe some guilt. So all of these things are kind of happening at the same time within ourselves. And I say this not to sound discouraging, but to say that I think caregivers need to give themselves some grace and realize that they're struggling too. And they're also sleep deprived. And they're not going to be their best selves at 1 o'clock in the morning when they're exhausted and at the end of their rope. There are several possible responses to trauma, and some of these we know about and we've heard about before. So fight or flight, most people know and have heard of. Those chemicals that we talked about, that cortisol and norepinephrine, those really cause that fight or flight reaction. You have that tiger, the tiger comes into your house and you're either going to fight it or you're going to run away. We know a lot of kids and a lot of adults also freeze when they're exposed to trauma. If I don't move, if I'm very quiet, maybe this scary thing won't notice me and it'll just go away. And I think we've seen kids and heard of kids like this. Those are the kids who are exposed to trauma who are very well behaved, very quiet, do what they're told, and that's their response. But there's another response that I want to talk about. I called it friends to stay with this theme of F's. And that's the response where maybe the tiger comes into your house and you go be with a group of people who can help protect you, or you call up your neighbor and say, hey, there's a tiger here. What do I do? This is the kid who wakes up in the middle of the night, has a nightmare, and goes into the room with their parents. And this last response is a helpful response during the trauma and once the trauma is past. This last response, this friends, this affiliation with other people, is what we really want to encourage, because that will help support children through the rest of their lives. And there's a lot of good evidence coming out now about the role of oxytocin, which we know helps people connect in dealing with trauma. I know I'm, preaching to the choir here, and we've talked a lot the past couple of days about connection and how important that is for kids who've been through something scary. This is from Center on the Developing Child. It's part of a much longer white paper. But the main point is based on multiple studies for kids who've been through many different kinds of stresses. The single most common finding is that children who end up doing well have at least one stable and committed relationship with a supportive parent, caregiver, or other adult. And this supportive relationship, adaptive skill building, and positive experiences gives kids the tools that they need to deal with the stress they've experienced in the past and stress moving forward. So when we talk about sleep, a time when kids are frequently by themselves, I really want us to think about, how do we build that connection at bedtime? How do we continue to build that friendship response to trauma at a time when kids are normally by themselves? And how do we help them develop that skill building and those positive experiences that will help them down the road and help them heal from the trauma they've already experienced? There are lots of different kinds of sleep disruption, and I have 4 listed here with some of the causes of these different kinds of sleep disruption. Certainly, this isn't an exhaustive list. We'll go through a few of them. So some of the troubles that kids have with sleep are falling asleep. And sometimes it's because kids are avoiding sleep. This is the kid who comes downstairs, I need another glass of water, I need you to tuck me in, I don't want to go to bed, I'm scared. That's that kid, the kid who's avoiding sleep. But there are also kids who have trouble falling asleep, even though they try. Those kids just can't fall asleep. So those are the kids that they go upstairs, they lay down, they're just laying in bed with their eyes wide open. You come back maybe an hour, hour and a half later, they're still lying there wide awake. Or they come down, I can't fall asleep, I tried, they seem tired, but they just can't fall asleep. Some kids fall asleep okay, but then they're waking up a lot in the night. They're having like a very restless or fitful sleep. So these kids may be waking up with nightmares, or they may be coming into your room in the middle of the night, or they may be saying, I can't fall back asleep, I'm having a bad sleep. And then there are some kids who seem like they're sleeping fine, but during the day, they seem very tired, they're exhausted, or the opposite, they're overtired. So they're really irritated and agitated. There are lots of different causes for each of these different sleep issues, but you can see that there is some overlap, particularly that idea of like hypervigilance, always being alert, that can certainly be caused by trauma. Nighttime triggers can overlap with several of these, anxiety. And so a lot of what we talk about will help with sleep issues, no matter what sleep issue the child has, if it's related to their trauma. And I'd like to take a couple minutes and just ask you guys, what's the biggest sleep issue that you are dealing with in your family? Whether it's one of these 4 or something else, if you guys want to share in the chat or just let us know. And I want to make sure that we're able to get to that, even if it's not already built into the presentation.
I guess my example would be the calming and soothing yourself to get to sleep. I guess calming that brain down to just calm. I don't know how else to say it.
Yeah, that like tension, that kind of like that hypervigilance that we were talking about, like having trouble settling when you're just have gone through the stress of a whole day.
Yes.
We'll definitely talk about that. Thank you. Anyone else want to share any sleep issues that their family's having or put it in the chat?
There are some people that wrote a few things in the chat. Do you want me to read them, or can you see
I
them?
think I can see them.
Okay, good.
So avoiding sleep, certainly. Avoiding sleep, yeah. Fitful sleep, sleeps too much. Okay. All right, so we'll definitely talk about a lot of those. One thing I will say about fitful sleep, and most parents can tell the difference, is that almost all toddlers are crazy sleepers. They like move around a ton in bed. That's not necessarily a fitful sleep, but like I said, a lot of parents can kind of tell the difference because the toddlers wake up and they're well rested. The kids who are actually having a fitful sleep wake up and they're exhausted. Or like I said, they're coming in the middle of the night. They can't fall back asleep. Awake every couple hours. Yeah, so waking a lot in the night. All right, so we'll definitely cover some of that. So as a physician, when I hear about trauma, I think not just about emotional trauma, but about physical trauma. And so one thing I want to think about moving forward in this talk is that trauma really heals in layers. I don't know if any of you have broken a bone before or needed a cast, but when that happens, when you break a bone and you need to get a cast, first the doctor puts on so the first thing actually is they have to stabilize the joint, right? Sometimes they need to put it back where it belongs, but the joint has to be stable. So that's really important. Then they put on a sleeve, they put on layers of either fiberglass or plaster. Those go on in layers. Over that, you can see right here, they put on this material to kind of keep everything together, keep the fiberglass from falling apart. And then at the end, they put on this ACE bandage. And emotional trauma is very similar. There's no one answer or one solution that I'm going to tell you today, unfortunately, that's going to work. You're not going to come back to me and say, Dr. Pointer, I used a nightlight and now all of a sudden my child's sleep problems are fixed. It's going to be layers. And hopefully we'll be able to give you some of those layers today so you can start working on that and eventually have enough layers that we can help to heal. Also, when it comes to trauma, we don't expect to go from nothing to, lifting the heaviest weights as we're recovering. We really measure our recovery in small steps. So first you can lift the 2-pound weight, then the 5-pound weight, and you celebrate each of those small steps. So I want us to think about sleep issues related to trauma in the same way. If your goal is to go from 4 hours of sleep to 9 hours of sleep overnight, that's not going to happen. But if you set your goal as we're going to try to increase our sleep duration by an hour, maybe in the beginning, or a half an hour, then that might happen over time. And then you can set a goal that's even larger down the road. So I want us to think about healing in layers and then also tracking our progress similarly in these layers, because that will really give us more of a sense of what can be accomplished, and I think help us to feel less discouraged. So we're going to talk about some trauma-informed sleep steps. The first couple, sleep hygiene and routine, are important for all kids who have sleep issues. And the last two, this idea of maintaining connection and calming and self-regulation, are more crucial and I think, more helpful for kids who have sleep issues related to trauma. And all of us know sometimes when you're going up the steps, you need a little bit more support from the railing. And so we also are going to talk about sleep or trauma-focused therapy, the possibility of short-term medication use, and treating coexisting conditions. We really, for all sleep issues, want to start with the basics. And these are all things that you guys already know. They're things you probably have already done. But sometimes when we're sleep deprived and we're exhausted and we feel like nothing is working, sometimes these fall by the wayside. So certainly making sure that kids have a screen-free bedtime. We know that the lights from phones and tablets prevent our brain from producing and releasing the chemicals that it needs in order to go to sleep. Even the nighttime light on the phones still produce the right kind of light to prevent your brain from realizing that it's nighttime. I usually recommend screens off about an hour before bed. And especially for kids who are older kids, teenagers, I say just keep the phone out of the room completely, because it is so tempting if you have the phone in the room and you're having trouble falling asleep, or you wake up in the middle of the night, it's so tempting to grab that phone, and then that sets you back again. Having a consistent bedtime and wake time is important. We're creatures of habit. And again, for older kids, some kids love to just stay up all night on the weekends, sleep until noon. I remember doing that myself when I was a teenager. But if you're working on sleep issues, as much as you can to try to have that consistent bedtime and wake time. Assessing the sleep space. Now, this is going to be different for every kid. Some kids need a quiet, dark room to fall asleep. Some kids can sleep great in the middle of a noisy living room, and you'll know your kid best, and you'll be able to tell over time how they best fall asleep. But make sure that they're in a sleep space that's good for them, whether they need a night light to feel more secure, whether they need total darkness. If you have one kid who wants one and one kid who wants the other, you can think about sleep masks. But just like I said, kind of keeping it in the back of your mind, is this sleep space the best for my child? I saw a patient a few weeks ago who was having a hard time sleeping. And I said, was there anything, she was in a new home. I said, is there anything about your old home that really made you feel better when you were sleeping? Did you sleep in the same room as someone else? Did you have a nightlight? And she said, I had these really cozy blankets. Now, are cozy blankets going to fix her sleep issues? No, but maybe they're one of those layers that can. And so you better believe this kid is going to get her cozy blankets. Limit caffeine. For older kids, this is coffee, soda, caffeinated teas. But for some little kids, they get really jazzed after the caffeine in chocolate. So think about that too. This isn't to say they can't have chocolate, but if you notice that your child is very responsive to that, maybe limit it before they go to bed. And then physical activity. I said physical activity instead of exercise because people think that exercise is like you have to change your clothes and head to the gym and work out for an hour, and that's not true. Even 5 to 10 minutes of physical activity a day, which could be going for a walk in your neighborhood, makes a big difference with being able to fall asleep more easily. This little kid right here is in a sleep space I wouldn't necessarily choose for my own child, but he looks like he's doing just great. Whenever you talk to someone about sleep issues, they're going to talk to you about the importance of routine. And the reason for that is that for kids who've experienced something very stressful, for kids who've experienced a lot of transitions or chaos, routine really makes them feel secure. If they are in a predictable situation, they know what comes next, it helps them to feel more calm, helps them to feel more stable. And we can kind of intuit this, right? We look at the picture on the left of the hopscotch. I think that makes most of us feel good. It brings back good memories. Once you've seen one hopscotch, you've seen them all. The numbers are always in the same order. But then you look at the picture on the right, and even looking at it, it makes me feel a little bit tense. You know, I don't know where it's going. I can't really tell what the pattern is. So for kids too, you know, having a routine makes a big difference in their sleep. Doesn't matter what your routine is, as long as it's consistent. So as long as you do the same thing every night or most nights, and the child knows to expect that every night. It helps if your routine is a way for you to develop that connection. So if it's something that you guys are doing together, whether that's praying together, reading a book together, just building in a piece of connection into that routine. And then it helps if it's calming. So pre-bedtime dance parties probably aren't the best option. But again, you have to do what works best for your child. So I had a teenager that I saw a couple years ago who was living with her aunt, and she was doing great, had no trouble falling asleep actually, but she loved to listen to this really like loud and energetic music before she went to bed at night. And her aunt thought that it would interfere with her sleep and was fighting it. And the truth was, she was sleeping fine. That was part of her bedtime routine. She felt like it helped put her to sleep. And so, like I said, whatever works for your family, you know, you're raising a very specific child. And so do what works for them. So I would love to hear if anyone wants to share some of the bedtime routines that you guys use in your family.
It's me again. We introduced either a shower or a bath to calm the muscles, I guess, just to relax. Some people it wakes up, some people it doesn't. In our family, it relaxes everybody. Calming and soothing music, running. Sometimes one of my children like Gregorian music. It's like monks.
Wow.
Very light. It seems to be consistent. White noise, just to kind of block out the extraneous, so that way you have something to concentrate on, but you're not thinking your own thoughts. And then one child, we set up the Libby app for to get to the library, and he has the Harry Potter series playing on his Alexa at night, so he's talked to, so that way his brain doesn't think about anything except for Harry Potter. And then
I like
all
that.
just kind of go to sleep.
That's great. A lot of people use like bath time as part of their routine. And I think it does. Yeah. I mean, I think when people are injured, we say, you know, use warmth to help kind of soothe your muscles. And so there's no reason that that wouldn't work, even if you're not injured, to help you to relax your body. I see nightlight and sound machine. Yeah, the sound machines are great. Brush teeth, books in bed. Rubbing the back is wonderful. We'll talk a little bit about massage later. The American Academy of Pediatrics does a brush books bed initiative. So that's great. And I really like the music. I think that's right, that it kind of helps to calm your mind, especially the Gregorian chants are very meditative. So you might know what your routine is, but it's really important that your child knows what the routine is too, because you may say, oh, we do this every night. I know that we do this every night, but maybe your child doesn't realize that. And so even more so, making sure that they know what to expect and they know that it's always going to be the same. And you can do that whether a child can read or not. So I'm going to show you kind of an embarrassing picture. So this was my family's bedtime routine before my children were old enough to read. My family tells me that number 3 looks like an angry bird and a decapitated giraffe, even though it's supposed to be a toilet and a sink. I'm a terrible artist. But basically, it was similar to what you guys said, you know, brush teeth, did their potty stuff. Number 4 is a stuffed animal in a water bottle, believe it or not. And then read books, listened to music, went to bed. And this is just a terrible example because I'm such a bad artist, but an example of how you can make your bedtime routine clear in a way that even little kids can really understand. So we talked about the importance of connection, especially in kids who've been exposed to a lot of transitions, kids who've been separated from people that they care about, and also just as a healthy response to trauma overall. Connection really does, like I said, it really helps us produce that oxytocin, which gives us that feeling of more connection and also calmness. And there are lots of different ways to connect, even when kids are going to bed, or connect when they're alone. One, for kids who really have a hard time with separation anxiety, kids who really need someone there. If you're not sleeping in the same room as your kid, one option is something called gradual separation. And that's when, you know, you start next to your kid's bed, and then you maybe move closer to the door, then you're sitting in the door, and then you move out to the hallway. Now, this can happen in one night if you're lucky. Sometimes this takes multiple nights. You sit next to the bed until they fall asleep, then you move a little farther away until they fall asleep. That's less than ideal because when they wake in the night and you're not there, sometimes that can cause that separation anxiety again, but some kids really need that. And like I said, for kids who are already afraid of being separated from people, some of the things that we use for sleep in other kids that have not been exposed to trauma don't necessarily work in these kids. So matched loveys or matched stuffies, whatever you call your kids, my kids call them cuddle buddies. Basically, this is where the child has one stuffed animal and you have an identical matched stuffed animal that you bring to bed with you. And you explain to the child that you each have the same thing, and when they're snuggling their stuffed animal, thinking about you, you're going to be snuggling your stuffed animal, thinking about them, and you guys are still connected, even though you're apart. The invisible string is very similar. So the invisible string is a book, but you don't even need to read the book. Just the idea can be very helpful for kids. And what it is this idea that even when we're apart, there's an invisible string that connects the child with whoever, with you, with other people that they love, other people that they care about. And so if they're in their bed and you're not there, you're still always connected by this invisible string. And you don't just have to use this at bedtime. You can use this if they're going to school. You can use this if they're separated from other people that aren't necessarily you, that they're always connected by this invisible string. And even pretty young kids can kind of get this idea. For the youngest kids, sometimes the matched stuffies works a little bit better because it's much more concrete. But I have, you know, a lot of like 4 to school age kids who really like this idea, the invisible string. For older kids or younger kids, having photos or notes that are taped or posted around their bed. So pictures of you or pictures of other people they care about, or little notes that you write them during the day, you know, maybe words of encouragement or little love notes. That's another way that you can stay connected to them over time. And the last is what I call alwayses. So this is something that I recommend a lot in kids who, like I said, have had a lot of transitions, have had a lot of change, maybe they've had losses, is making sure that you tell them, and honestly, so it's important that you are truthful in this, that you tell them things that will always be true, to let them know that there are some things that are stable and consistent, even though there may be other changes. So no matter what happens, you will always love macaroni and cheese. No matter what happens, I will always care about you. No matter what happens, both of us will always love to watch Moana. I don't know, whatever it is, but make sure that within those alwayses, you make sure that there's that sense of connection. I will always love you, or I will always care about you, or other people too, no matter where they are, will always have this connection to you. And you can make it silly, but it gives kids that sense of consistency, that there's some things that stay the same. A lot of these are tips for connecting with younger kids at bedtime. I would love to hear any of your ideas for tips for connecting with older kids at bedtime. So if anyone has anything that's worked for them with kids who are in those like middle grades or teenagers, that would be great to share with the group.
I just go over the positives of the day, I guess is what I would say, to make sure that the last things he hears is something good. So if there's something that he was like upset about during the day or whatever, he doesn't go to sleep thinking about it. Kind of like when you see a scary movie, the last thing you're thinking, oh, now you go to sleep and now you have a nightmare. So I try to bring up something super positive for the day to make it, and if I can't think of anything positive, I think of something pretty like a vacation or a lake, a beach or something and then sometimes that instead of Gregorian music, we might put ocean waves on, because everybody, when you think of a beach or something, it's calming. So
I like that. Yeah, I really love the idea of going through something positive in the day. Right, some families do like their highs of the day. I know a lot of families will do kind of gratitude lists or talk about things they're grateful for. And so even if, like you said, even if you've had a bummer of a day, there may still be something that you can think of that you're grateful for. Someone had mentioned in the chat a special bedtime handshake, which I love that idea. I think that's such a neat idea, especially for kids who aren't really into like snuggling or a bedtime hug or kiss, to have a special handshake. Reading books in bed together is great. Yeah, I say kids are never too old to have you read to them. And even if you're each reading your own book or People magazine, whatever it is, that's definitely a great way to connect with older kids. I think music can also be a really good way to connect with older kids. So if you have a kid who's really into music and you say, every night I'd like you to like share a song that you like with me, and I'm not gonna judge and I'm not gonna say anything about the language in it, but we're just gonna like listen to this song together that you want to share with me that you're listening to right now. I like all of these ideas. I'm definitely gonna use the special goodnight handshake in the future. Oh, I like the walkie-talkie too. So a way to separate from older kids, having a walkie-talkie where the kid has it there to call when they need you. And it really is like a security for them. And that kind of makes the separation even more gradual, because I would guess that in the beginning, the kids would probably use the walkie-talkie more often to make sure that you are still there and that you're responsive. And as they feel more secure, probably use the walkie-talkie less. So I really like that idea. And definitely like less formal and kind of more interesting than having them actually call you on the phone, because a lot of kids feel like that's more of a bother. Kids don't like to talk on the phone as much. So I like that. I'm writing some of these down to use in the future. All right, so we've talked a lot already about calming and self-regulation. And some people have already mentioned a lot of these ideas that they use with their own kids. So there are lots of ways to use the senses to really help with that calming of the body, to decrease that like hypervigilance and calm down that amygdala that we talked about. So someone had already mentioned massage, using soothing scents, maybe in a bath or maybe lotion, but some kind of soothing scents, using calming music, Gregorian chanting. Meditation is great for some kids. There are so many meditation apps and meditation services out there today for very little kids all the way up through teenagers. So meditation is great. Progressive relaxation is also really helpful to even little kids. And I always recommend that when you're trying these things at bedtime, you start by practicing them during the day, during a stress-free time. When you're both relaxed, when you're having fun, practice then, because if you only do it at night, then your child is going to be like, oh my gosh, this is that meditation that we do when I can't fall asleep. And it's just going to make them more tense. Progressive relaxation is when you kind of start at your toes and you say, okay, now we're going to relax our toes. We're going to pretend our toes are mush or a wet noodle. They're going to totally fall asleep. They're totally relaxed. Now we're going to move up to our ankles, totally relax our ankles, and you go all the way up the body. For little kids who have a hard time imagining that or have a hard time relaxing their muscles, you can have them kind of tighten or clench those muscles first and then relax them, and that gives them an idea of what that feels like. Breathing exercises are great for relaxation. I will warn you, I have never heard of a situation where just telling someone take deep breaths has been helpful. I think many people find it frustrating. And so similarly, make sure that you're practicing these breathing exercises during the day when they're calm, and try to give them a specific breathing exercise to do. Belly breathing, most of us know about. For kids, it's where you have them put their hands on their belly and they take a deep breath in and they watch their hands move up, and they breathe out and watch their hands move down. For little kids, you can have them put a stuffed animal on their belly and move the stuffed animal up and down with their breathing. Sometimes that's helpful as a way to visualize that and makes it more interesting for them. I'm sure many of you already know that Sesame Street has a ton of kind of calming and self-regulation videos. They have one for belly breathing. I think they actually have one for progressive relaxation too that Elmo does at bedtime. So that's something you can check out for little kids. Pizza breathing is great for little kids too, who have a hard time with other breathing exercises. That's where you tell them they have a piece of pizza and they're going to take a big sniff and smell how good the pizza smells. But the pizza's hot, 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 so you have to blow and cool off the pizza. And you can have them do that a couple times. So that helps with little kids. And then for older kids, using square breathing, which when you picture a square, it has 4 sides. So what you do is you breathe in for 4, you hold it for 4, breathe out for 4, hold it for 4. And you guys are welcome to try any of these things for yourself, because we could all use some calming and self-regulation too, especially when we're dealing with a cranky child at bedtime. For kids who have specific nighttime anxiety, I was telling one of my colleagues about this talk, and she said, don't forget to tell them about fairy spray. So I think someone mentioned this in the chat too. So fairy spray is like a mist bottle of whatever you need it to be. It could be monster repellent. It could be a special magic sweet dreams potion that you can kind of just spritz around the room to help kids with their specific fears. For a lot of kids, something that works is worry time. And that's when you say, okay, every day between 4 o'clock and 4:15 is going to be our worry time. We're going to sit and we're going to worry, and that's when we're going to do it. But right now is not that worry time. So we're going to put our worries aside and we'll remember them tomorrow at 4 o'clock. And in the beginning, you really have to come back at 4 o'clock and remember that worry time, because otherwise they won't trust you. A worry container is very similar. We're going to take our worries and we're going to put them in this container for now, because you don't need them at bedtime, but you can take them out later. And then, of course, reassurance. Be careful when you're talking to kids and reassuring them that you don't use language like, don't be scared, or there's nothing to worry about, because it makes kids feel like they're being dismissed. And it also makes kids feel like you don't really know what you're talking about, because they know there are things to worry about. There are things that are scary out there. So instead, make sure you're using language like, you've got this. You know, you were worried about this 2 nights ago, 3 nights ago, and you were still able to fall asleep. Or you were worried about this in the past and you were able to overcome it. So make sure that you kind of frame it in the positive, giving kids that sense of agency that they've managed to overcome something in the past and that you know they can overcome it again. A lot of families will come to me and they'll say, Dr. Pointer, we tried all that and they're still not going to sleep. And I want to make sure that even if all of this stuff has been tried, you don't forget, don't give up on the basics. That sleep routine, sleep hygiene, connection, calming, all of those really are the building blocks for sleep habits that will last a child's life. So even though it can feel discouraging, make sure you stick with the basics. Definitely seek professional help. Talk to your pediatrician or your therapist or psychiatrist. We looked at that list of sleep problems. Many of them can be caused by medical issues. So maybe your child needs to be screened for medical causes. Kids are not neat little packages who just have one problem. Kids can have sleep issues and also have coexisting conditions like anxiety or PTSD or attention deficit disorder. So maybe they need to be evaluated for a coexisting condition. Certainly consider trauma or sleep-focused therapy. I think all kids who've been exposed to serious trauma should probably be in therapy already. I listed a couple here that are very evidence-based for trauma and sleep issues specifically. So trauma-focused CBT, and CBT in general has been very good for sleep in prior studies. And then EMDR also works really well with trauma and sleep. And then consider short-term medication if needed. And we'll talk a little bit about that later. Is there something else going on? So trust your judgment. You know your kid best. If you're worried there's something else going on, definitely talk to your doctor. But these are some signs that there might be something else, a medical condition or other condition to look out for. So snoring or breathing problems at night, strange movements, like we talked about, that daytime sleepiness or irritability without a sleep issue, certainly any physical symptoms, and mood or activity changes. A lot of times when we think about things like depression or anxiety, we really think about mood changes or behavior changes. But remember, these can also show up in other ways, like problems with sleep, but also change in appetite, too much energy, too little energy. Maybe they're moving really slowly or talking really slowly or doing those things faster than usual. So those are all signs that maybe you need to talk to your doctor sooner rather than later. What about medications? So unfortunately, there's no great pill that just helps kids who have sleep issues not have sleep issues anymore, right? There's not an easy fix when it comes to medications, but I think there are some things to consider when you're deciding whether to look into medications for your child. One is sometimes you need sleep to get sleep. We talked about all of the effects that sleep deprivation can have on you, can have on your child. And sometimes we're so exhausted, and that leads to so many of these other problems. You know, like I said, children can have even more fear, even more anxiety, even more dysregulation, that they can't even work on those strategies to get to sleep. Or maybe they've been having such a hard time falling asleep that that's caused a new fear for them, this fear of not being able to sleep. And that leads to another cycle where they're so worried about getting to sleep that, again, they can't really work on or use those strategies that they need. Remember, of course, if you're going to use medications, to use them with, not instead of, other strategies. Like we talked about, you know, we really want kids to have good long-term sleep habits. And so those basics, you know, need to continue even when kids are on medication. But medications can help in treating some of those coexisting conditions. So some of the things that we talked about in the past, things like depression, anxiety, PTSD, medications can help with that. And those might be contributing to the sleep issues in addition to their trauma. And then keep in mind that there are no FDA approved sleep medications for children. This is true with a lot of treatments for children who have trauma exposure, sleep problems, other mental health issues. There just aren't a lot of FDA approved options out there. And so we do use things off label sometimes. I listed here a couple of medicines to be wary of. One is diphenhydramine. You guys know it as Benadryl. Certainly, if you give a kid a Benadryl, it can help them be more tired and can help to put them to sleep, and they may sleep well throughout the night. So that's true. In many kids, in about 10% of kids, it has a paradoxical reaction. That means instead of making them more tired, it actually makes them more hyperactive. This is especially true in kids who have autism or ADHD or anxiety, or maybe trauma exposure too. So you may have the opposite reaction than what you were looking for. And it requires an increased dosage over time. So if you start Benadryl today, within a week or two, that same dosage of Benadryl probably isn't going to help your child go to sleep anymore, and you'll have to go up on the dose. Within a short amount of time, you're going to have to go up on the dose again. And that's a problem because Benadryl has these non-selective, meaning Benadryl really affects your whole body. It's not a focused medicine. These wide-ranging, unpredictable side effects. The side effects can be dangerous, and they can really vary from kid to kid and from dose to dose. And the higher your dose, the more likely you are to have some of those dangerous side effects. So I never recommend diphenhydramine, Benadryl for long-term sleep issues in kids. Benzodiazepines is another medicine you're probably familiar with. These are things like Ativan, Xanax, but there are a ton of different ones out there, a ton of different brand names you guys have probably heard. Like Benadryl, there is this dose tolerance, which means you need to progressively increase the dosage over time. Again, a smaller dose might work initially, but it's going to get bigger and bigger and bigger over time. And these medicines can lead to dependence and withdrawal symptoms. So dependence, meaning that when you stop the medicine, your sleep issues are going to be even worse than when you started the medicine. And then withdrawal symptoms are just, you know, these physical symptoms of withdrawal that you get from stopping the medicine because your body has become so used to it. The other thing to know about benzodiazepines is for PTSD specifically, for post-traumatic stress disorder, especially in studies with adults, because it hasn't been studied as well in kids, but these medicines are ineffective and can actually worsen their symptoms. So in kids who have a history of trauma, I really never use these. I won't say never, but I very rarely use these because they can have a worsening of their symptoms. They're not really solving the problem. Melatonin is the medicine that I get asked about the most. So melatonin is a hormone that regulates our internal sleep clock, our circadian rhythm. It's affected by natural light and darkness, which is why it's really important for kids to get outside, get some light during the day, and then put away the screens at nighttime. It might help with falling asleep. It doesn't usually affect nighttime awakening. There are some kids who are on longer acting melatonin. Sometimes it helps those kids with nighttime awakening, but not usually. It usually helps with falling asleep. And remember, it's not a sleep aid. So it doesn't put you to sleep. It just tells your body that it's time to go to sleep. So if you take melatonin at 1 PM, nothing's going to happen. You're not going to fall asleep. But it does help with kids who maybe have had kind of chaotic bedtimes, or their bedtime has changed recently, or they're just always up until 2 or 3 in the morning and they've gotten in that habit. Their body's gotten used to that. It helps them reset that clock a little bit earlier. Of course, with any medicine, talk to your doctor first. Even though this is over the counter, still talk to your doctor first. You take it 30 to 90 minutes before bed, and you can kind of tell, you can guesstimate with your kid. Try about 60 minutes to start. We recommend you start at the lowest doses for kids. So that's 0.5 to 1 milligram. And then children should stay under 5 milligrams, but use the lowest dose that works for them. There have been a lot of studies looking at melatonin. It's not regulated. So there's a dosage written on the bottle. And most of the time, the dosage of the actual melatonin isn't the same as the dose that's written on the bottle. And the best way to avoid this problem is to look for a GLP or GMP label, and that'll make sure that what you're actually getting is what you think you're getting. Alpha-2 agonists are another class that can help with sleep, particularly if kids have coexisting conditions. One that I use more frequently is clonidine, also known as catapres. Guanfacine is another one that you guys may have heard of. It's called 10X, it's called Intuniv, depending how you take it. Both of these medicines may help with that hyperarousal, that hypervigilance that kids have, specifically in PTSD and anxiety. Clonidine's used a lot with that hyperarousal and PTSD and anxiety. Clonidine's also used sometimes for kids with autism who have some behavior issues, some agitation, and also sleep problems. It can help with that. Guanfacine specifically can help treat the impulsivity and hyperactivity in kids who have ADHD. So some kids who have ADHD and sleep issues, this works really well for them. These were initially developed as blood pressure medicines, and some of their side effects are low blood pressure, low heart rate, sometimes dizziness or dry mouth, headache, and of course, sleepiness. I usually monitor blood pressure in kids about every 3 to 6 months, depending how long they've been on the medicine, more frequently early on, but kids tend to tolerate these medicines pretty well. There was a question in the chat. If they're on melatonin and they aren't able to fall asleep, do you up the dose? I think it depends how long they've been on the melatonin for, and if it was ever effective for them. I would say if you are starting it recently, so you have a kid who's not falling asleep, you start them at the 0.5 to 1 milligrams, they're still not falling asleep, I think then it's reasonable to up the dose as long as you stay below that 5 milligrams, because different doses work for different kids and it's not necessarily size related. And so I think then it's reasonable to increase the dose. if you start melatonin and it helps them fall asleep and they've been stable on the same dose for a long time, and now all of a sudden they're having sleep issues again, then I would kind of question if there's something else going on, because kids on melatonin don't typically become dependent on it the way they do on other medicines. They don't tend to get used to a certain dose and then need a higher dose over time. Another medicine that I don't have listed here because it's not something that I use is prazosin, but has been helpful in recent studies in people with PTSD specifically and PTSD related sleep issues. That's a medicine that's kind of related to clonidine and guanfacine and that it has similar side effects, but that's another medicine that you might hear about that has shown some promise in sleep issues related to PTSD. Any other questions about medications for kids' sleep? I get a lot of questions about meds specifically.
Hey, Alicia, earlier
Yeah.
today, I think you mentioned oxytocin or something, and I was just wondering if that's ever used for sleep.
Yeah, so it's not available in medication form. So it's not. There are some herbal medicines that I get asked about sometimes for kids. I know that, so we all have heard like chamomile tea helps with sleep. And there are some companies, I think Highlands has one. There are a few out there that have kind of these like herbal natural sleep pills that tend to mostly be chamomile. That's something that can sometimes be helpful for kids. You have to be careful because if kids have seasonal allergies, sometimes the chamomile can make it worse, specifically ragweed. Those kids tend to have more allergy symptoms if they're taking chamomile. So that's one that I hear about sometimes. It's generally very safe, generally very well tolerated. Hydroxyzine, that's a good question. So I would say safer than Benadryl, kind of works similarly. I do have some kids who've been on it longer term though at the same dose and have done okay. Kind of similar side effects, like kind of sleepiness, nausea, dizziness in some kids. But again, most kids do okay. I think you just have to be careful because there is sort of a bigger side effect profile. And for some kids, the dose is going to need to increase over time. So the sleep medications that adults used have not been studied well in kids. Those are like hypnotics, so like Ambien or Lunesta. Those are not recommended for children for a lot of reasons. They can exacerbate some mental health issues. They, again, have a lot of side effects, and they just haven't been studied well in children. But I think specifically because of the possibility of exacerbating mental health issues. Valerian is one that I hear about sometimes from people who are interested in like herbal medicines for kids. Generally very safe. But sometimes in kids, it can increase their anxiety, increase their heart rate, which is like the opposite of what you want. And so in kids who have anxiety, I tend not to recommend it. Oh, so Carolyn asked a question about doxylamine succinate. I don't know about that. So I can't answer that question, I'm sorry. But I will look into it, I'll write it down. Some people use different antidepressants for sleep in kids. So tricyclic antidepressants are sometimes used, like trazodone is sometimes used. And I think, you really have to talk to your pediatrician or your psychiatrist and see what's going to work best for your kid. It really depends what else is going on. If they also have depression, a medicine that helps with both might be really useful. Just like guanfacine really helps with kids who have ADHD and sleep issues. So I think it depends what else is going on. You really have to balance that side effect profile with the benefit that you're going to get. And then I'm going to talk, would a sleep study give answers to what needs to be addressed? So that's a really good question. A lot of families ask me about a sleep study, and I think sleep studies can be really useful for a couple things. One is if you have one of those kids who seems like they're sleeping okay, but then they wake up in the morning and they're like exhausted or really irritated, or they seem overtired during the day. That's one kid that a sleep study might be really helpful, because maybe they are actually waking up a lot in the night because of that like hyper arousal, and we just don't see that. Another reason it might be helpful is a kid who's waking up a lot in the middle of the night, and once they're awake, now they're feeling anxious, or they're coming into your room, or they can't fall back asleep. But maybe there's a reason that they're waking up a lot at night. You know, maybe they have like a restless leg syndrome or a sleep apnea or something like that going on. And then once they're awake, then they're awake because they have this trauma or they have anxiety or for whatever reason. So that would be another reason that a sleep study would be helpful. Someone had talked about their child getting a ton of sleep, sleeping a lot, you know, like 15, 16 hours. That might be a kid who really isn't getting a restful sleep when they need to. So for all of those kids, I think sleep studies can be really helpful. Of course, a sleep study can be in a different environment than what they're used to. And if you can do it in your home, that's really the best way to do it. But I do think it can be helpful in those situations. If it's a kid who just won't go to sleep, who doesn't want to go to sleep or has a hard time falling asleep, a sleep study will be less helpful for those kids. And the like weirdness of a sleep study might make that problem even worse. I think we're almost at time. I do have a few slides about treating coexisting conditions that you guys can look at later. I'll try to post them. So basically, you know, I talk about depression and anxiety, which I know are very different, but we use similar medicines and similar therapies for both of them. I have a low threshold for treating kids with depression and anxiety initially with therapy or medication. I'm not necessarily talking about medication in all cases. Of course, while you're working on sleep strategies and mood, and you guys can look at these slides here. ADHD, I want to touch on really quickly because symptoms of trauma and symptoms of sleep deprivation look so much like attention deficit disorder that a lot of kids get misdiagnosed. And even the questionnaires that we fill out, even seeing professionals, if the attention deficit symptoms started around the same time as the trauma and sleep symptoms, work on those things first. Work on therapy for the trauma, work on sleep strategies first. And then I talk a little bit about PTSD, which is much more simple and much more complicated because there really aren't great medications for kids who have PTSD. And so it really is working on sleep, doing the trauma-based therapy, of course, and then maybe considering some of those medications that help with the hyperarousal, some of those medicines that we talked about. I'm going to leave this here just as kind of a reminder. And I would say if you're going to bring anything home, you know, this is a lot, but maybe find one item from each of these steps, you know, one thing that everyone can work on with sleep hygiene, whatever that is, going for a walk, going to bed on time, whatever. One thing you can add to a routine or make sure your child knows about the routine. A lot of you have that done already. Maybe, you know, one thing from each category might be a really good place to start. And of course, like I said, you know, talk to your therapist, counselor, talk to your pediatrician about whether you need to look at some of these other things in the future. And I don't think we have a ton of time for questions. Pat, you can let me know.
Technically, we are finished at 7:45.
Okay, I think it's 7:45.
It is.
But I have my email address in I think my first slide. So if anyone has any questions, they can certainly feel free to reach out. And, you know, I'm always happy to talk about this kind of stuff.
Well, thank you so much for spending this time with us. I forgot to acknowledge the holiday earlier today, but I just wanted to wish everybody a happy Friday the 13th. And, be very careful as you go home tonight when you're all traveling, and we'll see you all tomorrow morning. We have a great speaker in the morning, Dr. Sharon McDaniel, and we got a lot of great workshops tomorrow. And thank you so much, Dr.
Thank
Pointer, for
you. Thank
being
you,
with
Dr.
us.
Pointer.
You're
Thank
welcome.
you.
Sweet
It's
dreams,
wonderful.
guys. I hope everyone has a good sleep tonight.
Oh, we